Welcome to Lesson 6, Diabetes Medications. When you complete this lesson, you will learn about the following: the different types of diabetes medications to treat type 2 diabetes, oral medications, non-insulin injectable medications, the different types of insulin. As we discussed earlier in Lesson 1, insulin injections are the only treatment for type 1 diabetes. However, there are many different types of medications that can be used to treat type 2 diabetes. Now let's talk about the different types of diabetes medications. There are several types of oral medications or pills that affect different organs and will reduce overall blood sugar levels. We will cover each type of medication. The names might sound complicated, but it is important to understand how each medication works. Medications that work with the liver. Biguanides, or commonly known as metformin. Metformin reduces the amount of sugar made in the liver. It may cause mild stomach upset, which will improve in a few weeks. Do not take if you have a history of congestive heart failure, CHF, alcohol abuse, or liver disease. This medication can cause a rapid heartbeat. Medications that work with muscle cells. Thiazolidine-dione, commonly known as Actos. Actos works by decreasing glucose in your liver, and it helps your muscle and fat cells use insulin better. Helps your body's cells to become more sensitive to insulin or reduce insulin resistance. Side effects include weight gain, edema or swelling legs, muscle or back pain, tooth or mouth pain. May increase the risk of heart disease. Medications that increase insulin production include DPP-4 inhibitors, sulfonylureas, meglitinides, SGLT2, incretin mimetics, and glinides. These medications increase insulin production, help move glucose or sugar to cells, and prevents high blood sugar. Sulfonylureas, gliburide, glipizide, and glimepiride can cause low blood sugar, especially when taken with insulin. Do not take with insulin. Do not skip meals. Non-insulin injectables. Glucagon-like peptides or GLP-1 are injectable medications, for example, Byetta, Bydureon, or Victoza. These GLP-1 drugs decrease your appetite and slow stomach emptying, do not cause low blood sugar. Side effects include nausea, loss of appetite, and weight loss. There are several types of insulin that work in different ways. It is important that you understand the differences. Rapid-acting insulin reduces blood sugar fast and should be injected right before eating a meal. Short-acting insulin starts working, that is, lowering blood sugar, within 30 to 60 minutes and covers meals eaten within that time frame. Intermediate-acting insulin reduces blood sugar for a half day or overnight. Long-acting insulin reduces blood sugar for one full day. Pre-mixed insulin is usually taken twice per day and reduces blood sugar for 8 to 12 hours. Always check your blood sugar at least 3 times a day, before breakfast, fasting, lunch and dinner, or before bedtime. Insulin injection techniques. Insulin is very effective in reducing blood sugar but can also be dangerous if your blood sugar becomes too low. Please make sure you are injecting insulin properly by following these guidelines. Always rotate injection sites. Using the same spot over time can cause lipodystrophy, a condition where fat either breaks down or builds up under the skin, causing lumps or indentations whereby insulin cannot be absorbed by the body. Always rotate to different areas of your stomach, keeping injection sites about an inch apart. Wash hands. Clean area with alcohol swab. Inject insulin in the following fatty areas: abdomen, 2 inches away from the belly button; outer thigh, do not inject in muscle; upper buttocks; back of arms, the fatty area. Pinch a layer of fat, not too tight, gentle enough to raise skin. Inject insulin. Now we will summarize what we have learned in Lesson 6, Diabetes Medications. There are different types of diabetes medications to treat type 2 diabetes. Oral medications work on different parts of the body like our liver, pancreas, and muscles. Non-insulin injectable medications are effective at treating type 2 diabetes and may help you lose weight. There are different types of insulin that reduce blood sugar differently. Always check your blood sugar at least 3 times a day, before breakfast, fasting, lunch and dinner, or before bedtime.